If someone has been poisoned or drank dangerously too much, every second matters. Stay calm. Do this first. When you suspect someone has been poisoned or has had a dangerous amount of alcohol, the world can suddenly feel like it's moving in slow motion. Yet every single second holds immense weight. In these critical moments, panic is the enemy, and calm, decisive action is your most powerful tool. The initial 90 seconds after you recognize the danger are often the most important. Before you do anything else, take a single deep breath and focus your mind. Remember these 3 fundamental steps. They are your immediate roadmap. Protect the person, get help on the way, and provide care until professionals arrive. The very first action is to assess the person's immediate state. Are they conscious? Are they breathing? This initial check is non-negotiable and must happen instantly. Speak to them in a clear, loud voice. Ask a simple question. Can you hear me? Are you okay? While you ask, gently tap their shoulder. If they do not respond, they are unconscious, a serious medical emergency. Simultaneously, check breathing. Lean down and place your ear near their mouth and nose. Look toward their chest. Look for the gentle rise and fall. Listen for air moving. Feel for breath against your cheek. Do this for at least 10 seconds. Normal breathing is quiet and regular. Gurgling sounds, shallow breaths, or long, alarming pauses are signs of a life-threatening problem. Your next step depends on what you found. If the person is unconscious, not breathing at all, or only taking infrequent, gasping breaths, call emergency medical services immediately. In India, call 112. In the United States, call 911. Do not delay this call. Tell the dispatcher, I have an unconscious person who is not breathing properly. They will guide you. They may tell you to start CPR if trained. If the person is having a seizure, is extremely agitated, or has visibly stopped breathing, call emergency services immediately. These signs mean core functions may be failing and require advanced care. If the person is awake, alert, and breathing normally, your next step is different. Contact your regional poison control center. In the United States, call 1-800-222-1222. In India, call AIIMS National Poisons Information Center at 1-800-11-6117. These centers are staffed by nurses, pharmacists, toxicologists. They will give precise, tailored instructions. Calling quickly can prevent an unnecessary hospital trip or confirm you need emergency care. Do not underestimate the expertise on the other end. It is a critical lifeline. Before you can offer any meaningful help, you must first guarantee your own safety and the safety of the affected person. Quick but careful evaluation of the surrounding environment. Chemical spill, strong noxious fumes, potentially volatile substances. Do not rush in. You could become a second victim. If you smell gas or powerful chemical odors, try to ventilate the area if safe, opening windows, opening doors. If unsafe, evacuate the person and yourself. Call emergency services from a safe distance and tell them about the environmental danger. Once the scene is secure, act like a detective. If the person is conscious and can communicate, ask, what did you take? How much did you take? When did you take it? Avoid asking why. Focus on facts for medical care. Locate and preserve containers, bottles, packaging, leftover pills or substances. Do not throw anything away. Check labels for ingredients, concentration, manufacturer contacts. If you can't take the container, photograph front and back. Get clear shots of ingredients and warning symbols. This evidence helps poison control and ER teams. It removes guesswork and speeds accurate treatment. One dangerous myth is that you should make the person vomit. You must not induce vomiting unless told by poison control or 911. Vomiting can cause major harm. Corrosives like bleach can reburn the throat. If drowsy, vomit can be inhaled, causing pneumonia or suffocation. Syrup of ipecac and old remedies are not recommended. Making the call to the Poison Control Center is one of the most effective actions you can take. When you dial that number, you are not reaching a simple information hotline. You are connecting with a highly trained medical professional who specializes in toxicology. These experts handle hundreds of thousands of calls a year, dealing with everything from a toddler eating a houseplant to a complex chemical exposure. Their job is to rapidly assess the situation and provide you with clear, step-by-step instructions. They are your co-pilot in this emergency, guiding you through the uncertainty with expert knowledge. Trusting their guidance is paramount. They know when a situation can be managed at home and when it requires immediate hospital care. To make the call as efficient as possible, be prepared with key information. The specialist will follow a structured protocol to gather the necessary facts. They will first ask for the name of the substance ingested. Having the container or a photo is critical. Next, they will need the approximate amount taken. Was it one pill or a whole bottle? A sip or a full glass? They will also ask for the time the exposure occurred to predict how far the poison has progressed in the body. Finally, they will need the age, weight, and any pre-existing medical conditions of the person affected. Having this information ready will speed up the assessment and allow them to give you the best possible advice without delay. Based on your information, the expert will recommend next steps. In many cases, particularly with minor or non-toxic exposures, they may determine that the situation is not life-threatening. They might advise you to observe at home for a specific period and call back if certain symptoms develop. This guidance can save you from a costly and stressful emergency room visit, providing peace of mind and a clear plan of action. They will tell you exactly what to look for and what to do, including specific first aid like rinsing skin or eyes, empowering you to manage the situation safely from where you are. Alternatively, if serious, they will tell you to hang up and call an ambulance or go directly to the nearest emergency department. Following this instruction is not optional. It reflects a high-risk assessment. They will often provide the hospital with pre-arrival information, so the team is prepared. This seamless coordination means no time is wasted once the patient arrives. Alcohol is so common in many cultures, it can be easy to forget it's a powerful depressant, and it can be toxic in large quantities. Alcohol poisoning, or acute alcohol intoxication, is a serious, sometimes deadly consequence of drinking large amounts in a short time. If someone drinks faster than their liver can process, their blood alcohol concentration can become dangerously high. That surge can shut down brain areas controlling life support functions. Breathing, heart rate, temperature regulation. Don't assume they will just sleep it off. Recognizing the signs is the first step to saving a life. Signs can look like drunkenness but are far more severe. Profound mental confusion, stupor, inability to be roused from sleep. If you can't wake them no matter how loudly you shout or how hard you shake, they need help now. Other critical signs: persistent vomiting, risk of dehydration and choking. Seizures may occur. Most importantly, watch breathing. Slow, fewer than 8 breaths per minute, irregular breathing, or long pauses, more than 10 seconds. Cold, clammy, pale skin or a bluish tinge is another sign circulation is failing. If unconscious but breathing, place them in the recovery position. 3 main steps. Position arm and leg to roll. Roll them onto their side toward you. Tilt their head back slightly to keep the airway open. Now, the step-by-step. Kneel beside them. Place the arm nearest to you at a right angle. Bring the other arm across the chest, back of hand against the opposite cheek. Bend the far knee. Use the bent knee and arm to roll toward you. Finally, tilt the head back slightly. Stay with them and monitor their breathing continuously until medical help arrives. Myths are dangerous. Do not give coffee or other stimulants. Caffeine worsens dehydration and does not lower BAC. Don't use cold showers. Shock can cause cardiac arrest. Never make them walk it off. Fall risk is high. Do not leave them alone. A person with alcohol poisoning can stop breathing at any moment. When navigating a poisoning emergency, the advice of seasoned medical professionals provides an invaluable layer of clarity. An emergency doctor might emphasize the importance of the first 90 seconds. What you do before we arrive can set the entire course of treatment. If you find someone unresponsive or breathing abnormally, your first and only job is to call for an ambulance. Don't waste precious time searching the internet for home cures. Activating the emergency response system is the single most important step. Toxicologists focus on the substance itself. Calling poison control immediately gives us the best chance to intervene. We need exact product info, bleach-based, ammonia-based, or something else, because each requires a different approach. They strongly reinforce, do not induce vomiting. The risk of aspiration is high and can cause a fatal pneumonia. Some of the most dangerous poisons are common: acetaminophen, ibuprofen, iron supplements, cleaning supplies, certain houseplants, and button batteries, which can burn through an esophagus in hours. Assess breathing quality if overwhelmed. Is it a struggle, noisy like gurgling, or are there long, scary pauses? Any of these in an unconscious person, rowers call emergency services. Check responsiveness and breathing immediately. Call emergency services for severe signs. Call poison control if awake and stable. Place unconscious but breathing person in recovery position. Preserve containers and labels. Take photos. Don't induce vomiting. Give activated charcoal, milk, salt water, or home remedies unless instructed. Give coffee, cold showers, or force walking. Leave them alone. In India, life-threatening emergencies. 112. AIIMS National Poisons Information Center. 1-800-116-11.